This is Debbie Bucher with Parkland College, the LPN to RN Transitions course, and today we're going to be looking at Chapter 8 in the LPN to RN Transitions book by Laura Claywell on practicing evidence-based decision-making. The objective of integrating evidence-based practice with nursing care is to empower the nurse to become a competent consumer of research. What is evidence-based practice? This is the integration of the best available evidence combined with clinical expertise, enabling health practitioners of all varieties to address healthcare questions with an evaluative and qualitative approach. The American Nurses Association has developed standards that help guide nursing practice and establishes a framework of bringing together the science of nursing into our everyday practice. The overall aim of evidence-based practice is to standardize practice by maximizing good practice, reducing cost, and improving quality of care. To integrate the best available research and clinical expertise in the context of patient characteristics, culture, and patient preferences as well as values. To use a problem-solving approach to nursing practice involving conscientious use of current best practice in making decisions about patient care. To use a problem-solving approach to nursing practice is, again, involving conscientious use of current best practice when we are making decisions about the best care for our patients. Most nurses lack knowledge with how to conduct research and how to access resources, and have a lack of planning for researching interventions and lack of support from administration to start change, or they do not feel empowered to do this in their work settings. Often they feel that there is no time to do this, but nurses need to be able to learn how to access current and past research to be able to decipher between high quality and low quality literature. That's very important. You want to get the best evidence-based practice that is out there. There are three unique key features to defining attributes of evidence-based practice. Three unique key features is problem solving in its approach, which takes into account the clinical experience of the nurse, and the clinical experience of the nurse is the nurse's ability to use clinical skills and past experience. 2, it combines research evidence with knowledge and theory. And 3, it allows for patient values to be expressed and incorporated in treatment regimens. Use of patient-centered research evidence allows for accuracy and precision of diagnostic tests and prognosis markers, and also allows for effective and safe treatment. Patients bring their preferences, concerns, and expectations to the clinical and hospital settings. 5 fundamental steps in putting evidence-based practice to work. Step 1, construct a relevant, answerable question from an identified clinical concern. Step 2, search the literature for the best external evidence that addresses the clinical concern. Step 3, critically appraise the evidence for validity and applicability. Step 4, apply the evidence to your clinical concern. And then step 5 is to evaluate your performance. So in that example with the children with otitis media, the problem stated is a child with otitis media. The intervention is antibiotic therapy. The comparative intervention is watchful waiting and observations, and the outcome is resolution of the acute otitis media. Another example is from the PICO is P, population in patients 65 and older with a new diagnosis of type 2 diabetes, how well they do. I is the intervention, and the intervention is patient education material regarding nutrition placed online and freely available 24/7, 365 days a year. And the C, comparison, is paper-based instruction handed to client at post-diagnosis visit. And O is outcome, feeling of self-efficacy in addressing nutritional changes. These are both on page 124 and 125 of your text. And also if you look at 125, again, the PICO, the P is the patient, population, or problem. So how would you describe a group of patients similar to yours? I is the intervention or issue of interest. What is the main intervention or therapy under consideration? Include exposure to disease, a diagnostic test, patient perception, and any risk factors. C, comparison of intervention if applicable. Is there an alternative to compare with the intervention? And O, outcome to be measured or achieved. What is the clinical outcome, including a time frame? So that kind of helps explain the PICO question a little bit further here. Next is prognosis, which is focused on the disease process, screening, and risk reduction. An example of prognosis is, what is the normal grief process in healthy women who suffer a miscarriage, and are there any factors associated with longer than normal grieving? Prevention, how to modify patients' risk factors to reduce the risk of disease. Does the influenza vaccine reduce the risk of pneumonia in patients diagnosed with a compromised immune system? And then qualitative is understanding a clinical phenomenon as the patient experiences it and values it. And clinical phenomena is an occurrence, circumstance, or fact that is perceptible by the senses. And so again, qualitative is emphasis on understanding a clinical phenomena, such as an occurrence or a circumstance or fact that is perceptible by the senses as the patient experiences it and values it. So again, in step 2, you're searching the literature for the best external evidence. The clinical question has now been identified and the question has been categorized. It is now time to track down the evidence. This is often a challenging process for the RN, especially due to time constraints and a lack of resources and research skills. Usually you want to start with a broad literature base and be familiar in the electronic databases. Often your librarians or your medical librarians can also be helpful in helping you do the research as well. And there are several journals and databases that are available. And again, the electronic resources that place strong emphasis on evidence-based practice studies and tools. The best of these is the Evidence-Based Medicine Reviews, or EBMR, from Ovid Technologies. The electronic address is http://ovid.com. And this is a group of electronic databases that include Medline, HealthStar, the Cochrane Library, the National Guideline Clearinghouse, as well as the Agency for Healthcare Research and Quality, which I've already alluded to, but I wanted to go over that again. So again, level 1 evidence represents the most valid reports addressing patient-oriented outcomes. A level 1 ranking also indicates that specific quality criteria were met based on the study type. And also randomized trials with at least 80% follow-up, inception of cohort studies for prognostic information, and systematic reviews of level 1 evidence reports. So again, when you're doing your research, level 1 is really the research that you want to base your practice on. So again, it just represents the most valid reports addressing patient-oriented outcomes. And then next is step 3 is again critically appraising the evidence, evaluating the strength of a study, and now we're looking at level 2 evidence. Level 2 evidence addresses patient-oriented outcomes and uses some method of scientific investigation. Level 2 evidence implies an association rather than reliable evidence. Level 3 evidence represents reports that are not based on scientific analysis of patient-oriented outcomes. So we have 2 different levels here. Neither one of those are as good, of course, as level 1 evidence. So in looking at level 2 evidence that addresses patient-oriented outcomes and uses some method of scientific investigation, and level 2 evidence implies an association rather than reliable evidence. So an example would be hormone replacement therapy was associated with reduced cardiovascular problems. There are usually less than 80% of randomized trials. There are non-randomized randomized comparison studies and diagnostic studies, but without adequate reference standards. And then level 3 evidence represents reports that are not based on scientific analysis of patient-oriented outcomes. So again, not even as good as level 2. So this would include case series, case reports, expert opinion, and conclusions that are extrapolated indirectly from these scientific studies. So step 3, critically appraising the evidence and evaluating the strength of a study. The strongest level is the systematic review or meta-analysis of randomized controlled trials and evidence-based practice guidelines. The weakest level is opinion from authorities and/or reports of expert committees. Critically appraising the evidence means to examine its validity, beginning with the overview. This requires knowledge of the research design and statistics and involves looking at the reference list of the study. So again, step 3, you're critically appraising the evidence and evaluating the strength of the study. 3 basic questions to ask is it worth looking at the results of the study? Can I trust the results or reliability? What are the results? And are the results relevant for the patient? So again, evaluating the strength of the study, questions to ask when performing a systematic critical appraisal are: was the review questions clearly stated? Is it likely that relevant studies were missed? Were the criteria used to select articles for inclusion appropriate? Were the included studies sufficiently valid for the type of question asked? Were the results similar from study to study, and what are the results? Common barriers in trying to do evidence research is the evidence accessibility. The end user, the nurse, may have inadequate access to clinical research evidence and guidelines. There may be a large volume of research to sift through. The research language may be hard to understand. There's complex data retrieval systems, and the individual may be resistant to change, which of course can be a problem. So next is a question. A nurse is using the PICO criteria to write a research question. In the research question, in patients with congestive heart failure, will ACE inhibitors compared with beta blockers improve ejection fraction? Which section is the comparison? And it's number 3, the beta blockers is considered the comparison to the ACE inhibitors. So again, your PICO question, the P is the patient or problem or population, the I is the intervention, the C is the comparison, and O is the outcomes. Limitations of evidence-based practice are accessibility. Again, I think I already went through this, the nurse not having adequate access or not having adequate time, split between education and service, lack of consensus among nursing responsibilities, lack of communication among nurses and researchers, lack of skills in locating, reading, and appraising nursing research data, and lack of organizational support can be barriers, as well as cost-benefit issues and system barriers such as policy, procedures, and financial accountability. So again, within the healthcare system, there may be systemic barriers such as policies, procedures, and financial accountability, physician idiosyncrasy versus discipline inquiry, cost-benefit issues, and bureaucratic structure. Again, nurses are split between education and service, lack of time, and again, lack of consensus without nursing responsibilities, lack of communication among nurses and researchers, and of course, lack of skills in locating, reading, and appraising nursing research data, and lack of organizational support. Not all nurses must conceive of and conduct new research. However, we as nurses need the ability and the empowerment to institute change appropriately based on research findings. So all nurses need to do this. All nurses need the ability and the empowerment to institute change and appropriately based on research findings. RNs must base specific interventions and all aspects of the nursing process on scientific research. This is incredibly important. And again, some more apparent gaps in research utilization, barriers, lack of knowledge of the availability of research applicable to nursing practice, lack of educational preparedness to understand research, again, lack of time, nurses are very pressed for their time, lack of authority to institute changes based on research, no forum for research-based practice change proposals, and there are a lot of times no clear method of launching a trial study. Also, many times nurses are resistant to change and think that the old way is good enough. And structures, policies, and procedures take time to change. And you really want to be an advocate for change on committees and understand how to apply research to practice as part of your job as a nurse. All nurses need to have the ability and the empowerment to institute change appropriately based on research findings. RNs must have specific interventions in all aspects of the nursing process on scientific research. And also research, both simple and necessary, are the easier ones for an RN to do. It's the simplest research for the RN, and quality assurance or quality improvement and performance improvement studies, they use data to determine whether patient outcome criteria are being met, charting is complete, or procedures are being done per protocol. The result of these studies is to assist the staff in achieving consistently excellent quality care. So again, that's one of the ways we can research as nurses. That's actually a little bit easier process of going about and doing. So with regards to concepts, consider the behavior of a patient exhibiting pain. The concept is pain, which is defined uniquely by the individual and manifested by the behavior. The pain is an abstraction because another individual cannot experience it in the same way. The concept of pain can be studied as a means to better understand similarities and differences in multiple patients' manifestations of pain. The research attempts to define pain in terms of common behaviors, refining the concept so it can be applied to a population of people rather than just the individual. There are also variables, which is a concept, idea, or attribute that is captured and defined within a research study. So named because it varies from subject to subject. A researcher attempts to control variables, statistically account for them, or explain them in relation to what is being studied. An active variable is where the researcher manipulates an active variable in an attempt to determine whether this will have the desired effect on the outcome. The attribute variable, the researcher has no control over an attribute variable. So example, determining the type of dressing most likely to improve outcomes would require that the RN researcher to study the difference in at least two different dressings, randomly assign each dressing to different groups of patients, and the active variable is the dressings because the researcher is manipulating them. The attribute variable would be the condition of the patient, sex of the patient, and other pre-existing characteristics of the patient. So variables, an independent variable is a variable that influences a presumed effect, and a dependent variable is a variable that is influenced. The purpose of the research study is to determine the apparent relationship between the independent variable and the dependent variable. Defining variables must define variables in a research study. An operational definition specifies the operations associated with collecting the data on that variable or how the researcher will measure the variable. An example would be imagine a study looking at the length of stay patients had with a certain disorder. The interest is in understanding why patients have varying lengths of stay, which is the dependent variable, and the apparent causative factor or independent variable for the differences. If the researcher notes a specific problem that seems to cause the increased length of stay, this problem will be designated as an independent variable to see whether an actual relationship exists. The researcher may also spin off further research to see whether the length of stay might be the reason for patients to have specific problems. Here the dependent variable would be the problem the patients are having, and the independent variable would be the length of stay. Literature search. You want to do literature search to determine whether prior research has been done. It can also help identify past research related to the study, can assist in defining the variables, formulating a hypothesis, establishing tools that may be needed to collect data, and clarifying the problem. Literature search may define the theory or identify additional variables that may need to be considered or controlled. Also suggests areas that are not well supported by research. Serves to support the findings. The nurse who understands the components of a research study will have better clinical judgment, which leads to improvement of patient care. All research begins with the concept on which a study will base its actions and center its focus. Okay. Question. A nurse is testing two types of wound care for patients of all ages, genders, and diagnoses. The wound care would be randomly used on different patients, one group receiving one type and the other group receiving the second type. What is the active variable in the study? And 4 would be the wound care. So the active variable in this case is the wound care. The attributing variables would be condition of their patients, their sex, and other pre-existing conditions over which the researcher does not have control. The attribute variables would be the condition of the patients, their sex, and other pre-existing conditions over which the researcher does not have control. The attributing characteristics over which the researcher does not have control, and the attribute variables should be the condition of the patients, their sex, and other pre-existing conditions over which the researcher does not control. So the hypothesis again is a written prediction made by the researcher with regard to the variables. It directs the research by setting limits to the study because the researcher will try to prove or disprove the prediction. Generally, the hypothesis results from a question the researcher has with regard to a specific concept. These questions often come from practice situations where empirical data or objective evidence would suggest a relationship between the variables. Defining the research study, the research design, and experimental design controls the independent variables and randomly assigns the subjects to study groups. The quasi-experimental design researcher does not attempt to randomize the students, but does attempt to show a relationship between the dependent and independent variables. Defining population. Population chosen is the one that will potentially benefit from the study results. Make a data collection plan. For a qualitative study, you ask the questions of who, what, when, why, when, and how. Describe the relationship among variables. Qualitative study attempts to clarify underlying assumptions that are vague or unclear by asking what the procedures, beliefs, or tenets are within a particular setting. Also, may conduct a pilot study before implementing the actual study. So again, checking reliability and validity. It's criteria that is used by researchers that test that their instruments, tools, machines, and research designs will yield accurate results in which the question or hypotheses that is being researched. Examples of instruments are questionnaires, interviewing techniques, test observation or machines, monitor scales, or other device or methods. Okay. And again, collecting data and interpreting the results are both very important steps to do in your research. And on an example would be circulatory problems in diabetes that leads to foot ulcers. The entire population of diabetes would be impossible, but looking at a certain age range or admission range would narrow it down a bit. give you better statistical analysis. I'm going back a slide here, going to communicating the results. It's the final step. Research summaries may be submitted for publication, and this includes a section that demonstrates how the research will apply to nursing. And the use of this information requires thoughtful consideration before applying to current practice. Again, validating research results, critically read and evaluate to determine whether the research has applications to practice. Apply research to practice. Direct research utilization is actually changing a practice habit or including a new intervention in practice. Indirect research utilization is enhancing knowledge base, and persuasive research utilization advocates for practice change. And identifying areas for research, there needs to be objective evidence from clinical observations gathered from patient care experiences, can help to think about and pursue research questions. Staff RNs may take part in the study through data gathering or testing new procedures or products, and you really want to encourage all nurses to bring research into the daily practice, and this will ultimately help improve patient care. And identifying areas for research, remember you need objective evidence from clinical experiences gathered from patient care experiences and can spur research questions. Staff RNs may take part in the study through data gathering or testing new procedures or products, and encouraging all nurses to bring research into their daily practice will ultimately help improve patient care.